A new study suggests young women who report heart attack symptoms are more likely to have them dismissed by doctors as not heart-related. The Yale School of Public Health examined the relationship between gender, age, and how the symptoms are perceived by healthcare providers.
Dr. David Agus, professor of medicine and engineering at the University of Southern California, is in L.A. with more on this. Good to see you, doctor.
Good morning, Vlad.
So let's start with the basics. What were some of the heart symptoms that young women, or what are some of the heart symptoms that young women should be looking out for?
So chest pressure, chest pain is the most likely, over 90% of young women. And we define young in this study as under the age of 55 have that chest pressure. But there are also things like, facial flushing, dizziness, nausea. Your stomach, your heart is right above your stomach. So if there's limited supply to the blood in your heart, you can actually feel it many times in your stomach. There are lots of things. So if something doesn't go away and it's accompanied by chest pressure, that is a warning sign. Talk to a doctor right away.
Okay, so you can see a little bit how those symptoms might be a little misleading, why if you don't know about them ahead of time, you might not think you're having a heart attack. But according to the study, women under the age of 55 are more likely than men to tell their healthcare providers about heart attack symptoms, but their providers dismiss them. Why is that? Is it some sort of bias that we're sort of unaware of? What's going on?
I think it's a couple of things. One thing in this study is that women tended to present with many other symptoms in addition to the chest tightness and chest pain, so doctors look for other causes of it. Second is women under the age of 55 are not who immediately comes to mind when you think of heart attacks. What's interesting in this study is that still most of the women had the high risk factors. They were smokers, they were largely body mass, they had diabetes or other diseases. So it really we need to pay attention as doctors to these symptoms.
So how dangerous is it to have some of these symptoms misinterpreted?
Well, Vlad, it ain't good. So the sooner you intervene in a heart attack, the better the outcome is going to be. The more there's limited blood supply to part of the heart, the more the heart can die. You can get cardiac arrhythmias, you can get sudden death, which, by the way, is a bad outcome. You can get a dysfunction so it doesn't pump blood through the lungs, and you can get lots of shortness of breath. You need to intervene early. So if these symptoms are happening, talk to your doctor. If they don't buy that this could be heart, ask why and really push.
When I think about the fact that we're talking about women under the age of 55, and I think about how, as women we're taught to be good girls and, don't rock the boat. And so you go to your doctor who's an expert and he or she says, I don't think it's a big deal. How do you make sure that you're getting the most thorough examination and that your healthcare provider is providing you with the best health care?
You hit it, Emery. This is an unusual pain in the chest. These are symptoms that, as a constellation, seem to push toward the heart. So say to your doctor, listen, you may not think so, but let's get an EKG and be sure. An EKG can be done in any doctor's office. You lie down, they put the leads on, and they get the data about your electrical conductance. In addition, there's a blood test that can very easily and quickly rule in or rule out that you're having a heart attack. So push for these tests. You know your body best. You don't feel right, push.
It's really fascinating.
I want to ask you one more question, because when you said that many of these women had some of the other risk factors like smoking, diabetes, being heavier set, a part of me was like, oh, well, I don't smoke, I don't have diabetes, maybe I'm sort of out of that risk factor. Should I be able to should I rest easy, or can you not be having those risk factors and then still sort of have a heart attack without knowing it?
It's a great question, Emery. No question is that those risk factors raise your risk, but so do things like family history. And that it just happens. So no matter your risk factors, obviously risk factors, pay attention and reduce those risk factors. But no matter the risk factors, you need to ask the questions and push. And again, you know your body best. It is your right, and you need to say to the doctor, listen, this doesn't just seem like an upset stomach to me. Let's do another test.
Very good advice. Dr. David Agus, as always, thank you so much for your time.